Hey guys, welcome to Savvy Medicare Planning, what baby boomers need to know about Medicare. I'm Danny Ratliff with Richard Rosso. Thank you guys so much for joining us today. Know there's a lot of things you guys could be doing, but hopefully you guys ordered some food in or you got something ready to go and you can have a little lunch while we go over the fun and often complicated topic of Medicare. So today the point is to break this down in an easy way for you guys to understand the basics. And then from there, we're going to be doing some more webinars in the future to go a little bit more in depth, but we will open this up for questions. So if you guys do have any questions, please go to the comments section. We're going to do our best when we get done to answer as many as we can. If not, you can always go to riaadvisors.com, go to the Ask a Question button. We'd love to connect with you. So first and foremost, we are a little bit of disclosures. We are Clarity Financial and doing business as RIA Advisors, a registered investment advisor with the SEC. So don't take any of this as, the gospel or specific advice. Please don't hesitate to reach out, contact somebody, do your homework, do your due diligence. We're just trying to educate and spark some questions. So thank you again, and we're going to roll right in. So Rich, you want to get started with what is Medicare?
Medicare is designed as a national health insurance program for people 65 plus. You all probably knew that, but what you don't know are the nuances, which we're going to go over today. And it's administered by the CMS. And you enroll through the Social Security Administration. And they are tied together. So in other words, if you're close to, and we're going to get into enrollment periods, there are various enrollment periods, you should go to ssa.gov and get your ID set up. Right? If you're on this webinar, you're close or close enough to Medicare, and you should also be checking your Social Security statements on a consistent basis. But you need to set up the ID, because the way you're going to set up for Part A and Part B, which we'll get into, is through the SSA. So I would suggest that as a little bit of homework for you all during the weekend, over the weekend, to get that set if you haven't done it already.
So who is eligible for Medicare? That's going to be everyone over age 65. So all U.S. citizens, legal residents who have lived in the U.S. for at least 5 years. And then also you can be eligible for disability benefits. So, there's a handful of ways to actually be eligible. Now, does that mean that a lot of people think, well, I didn't have enough qualifying quarters for this one? And most of the time people get this confused with Social Security. Social Security, you need 40 quarters. Even if you didn't, you actually are eligible for potentially a spousal benefit.
Yes.
This as well works the same way. But, the main two components are over 65 or disabled under 65.
Right. You probably, if you meet the definition or Social Security's definition of disabled, then you're most likely on Social Security disability income as well. So as you can see, there are 4 parts, right? So we call it in the ad, the alphabet soup, right? There's an alphabet soup you need to learn. There's Part A, Part B, Part C, and Part D. There's something else that surrounds these, but we'll get to that. But just remember, A, B, C, D is your part of your alphabet soup or some of the letters in your soup.
Yeah, and we're gonna discuss a little bit more detail about each one is and what that means for you. And so really the basics. So you really have 2 options when it comes to Medicare. You have original Medicare, which is historically what we would advise people to get on, unless there's really just a cash flow issue. And then there's Medicare Advantage, which is going to be typically it's going to be more of a bundled group. It used to be primarily HMOs. We are seeing some things change with that, where we are seeing a lot more PPOs, open network, but there are some disadvantages to Medicare Advantage. So we'll just take a step back. Yeah. Option 1, Part A is going to be with your original Medicare. You're going to sign up for that. You've already paid into that with your FICA over the years. Part B is what you're going to be probably most familiar with paying for, right? Part A is hospitalization. Part B is going to be just your preventative care, going to the doctor, things of that nature. Then you can add, which most people do, Part D. That's going to be prescription coverage. And then your Medigap policy. We look at Medicare as Swiss cheese. It has a lot of holes in it. That Medigap policy is there to fill in the holes. If you're close to 65, you're probably getting a ton of information, mailers, flyers on Medicare Advantage. And that is what we consider Part C. So a lot of times you're going to see it's going to have your Part A, Part B, Part D, plus some things that Medicare does not cover, like hearing, dental, vision, those types of extra add-ons. Now, historically, it's not very expensive if you want to add that on to original Medicare, but Part C has really gained a lot of traction. We'll get into some reasons on probably why. A lot of times people do like that because there may be zero premiums. You may get an Apple Watch or gym membership. Those seem to take in the place of a toaster at the bank, right? They're incentivizing in other ways for you to get on that. And we can talk a little bit more about what some of the reasoning behind that may be. So,
Danny, can you go back a little bit? I want to go back to that last slide for a minute. I just want to help you all understand, when you look at Part A, that's free for you or your spouse, right? If you paid into Medicare over 10 years. A lot of times you will be faced with the fact that at your employer, they may say, sign up for Part A, right? It's free. Your employer insurance, let's face it, this takes place at 65, but if you look at labor force participation rate, the majority of people 65 and older are still working, right? It wasn't that way. There's some magical age that came up for retirement that's not really fitting into the current world. So keep this in mind that A is covered. It doesn't. Part B is the physician services, other things that are part of everything, the periphery around your hospital stay. And again, there are monthly premiums for that, although affordable. Part D premiums, which whatever plan you choose, and we'll get into that, that's paid to private insurance companies whose drug plan you choose. And I'm sure if you've gone to Walmart and Costco and Walgreens and CVS, you've seen ads for their Part D insurance. So, and Johnny, you brought up a great question. We're going to cover some of this as we go forward, because today's environment has to be looked at through today's eyes versus when this was created. And some of you may not really be needing to sign up for A or B or Medigap or coverage, which we'll get into, until after you stop working because of insurance. So we're going to talk about this Medicare enrollment process, which can be a little bit complicated at times.
It is kind of complicated in some ways because you have the alphabet soup of all the different letters, right? And when, we think about it, there's really three main enrollment periods and reasons why you would want to be enrolled. And so, one thing is that if you are still working, a lot of people will think, oh, I don't need to sign up for Medicare. And for a lot of people, that is the case. But if you're working for a small business with on a group plan that covers 20 or and if you don't have a plan that covers 20 or more people, then you are going to have to enroll in Medicare when you turn 65. And there's some pretty hefty penalties if you don't. And we're going to get into that as well. But you could also, so to Johnny's point, if you're covered by your wife's health insurance plan and it is considered a creditable plan, you will not have to sign up. But I would always check with HR. They're going to have to show Medicare when you do enroll that you were covered by a creditable plan. And so that's really important so you don't get that penalty. So going into the penalty aspect, Rich, you want to cover this?
Yeah. Enrollment, as Danny said, there are multiple enrollment periods, and they'll all possibly mean something to you. The government we were supposed to consolidate them. There was an act out there to say, why do we need all these enrollment periods? But unfortunately, it's Congress and the government. So, we won't be seeing that for a while. So there are penalties that are late enrollment penalties. And these enrollment penalties are for people who fail to sign up within 12 months or outside their enrollment period. So you got to keep in mind that when these, we'll get more into it. If there are late enrollment penalties for a B coverage, D coverage, there are penalties. Those penalties are for the rest of your life. And I will tell you, there's no way to fight them. And I think like 30 to 40% of enrollees miss enrollment. and
Yeah,
stuck
a
with
lot.
permanent penalties, which is absolutely crazy. So
Yep.
Jennifer, 20 employees at the company. And let's talk a little bit about this as people are jumping ahead. If you most likely have employer coverage, you want to go to your benefits department and ask them if they have creditable coverage, which means they qualify for you to not go on to Medicare Part B and start paying premiums because you have qualified creditable employer service. That is for drug and medical coverage. So that's what you want to do. You want to go ahead and just ask your employer, do we fit the definition? There are smaller companies that fit into definition because that's just one department, or they're linked with others and they have more than 20 and they might not even be aware. So always check with your benefits department, right? The other thing is some healthcare expenses aspect on the slide are not covered by original Medicare. As Danny said, we're talking a lot of Swiss cheese and we got to fill holes. And some of your private insurance options may be limited depending on what type of Medigap coverage or additional coverage you use to cover those holes in the Swiss cheese. And we'll talk about that.
So how do you enroll in Medicare? Rich covered this briefly at the very beginning. Go to ssa.gov. Medicare's Part A and B are automatic if you are receiving Social Security when you turn 65. You can decline Part B. Coverage will start the first month you turn 65. And then Parts C and D, though, are not automatic. And so that's where you go out and you get the Medigap or prescription coverage for D. Part C is going to be the Medicare Advantage. So you're going to have to go out and actually proactively enroll when it comes to that. So we did have another question from Paul.
Yeah.
And it said, once selecting option 1 or 2, are you locked in for all future years? Also, can you add supplementary coverages at any time? So you're not necessarily locked in. You can make a change. However, you have 1 period of guaranteed insurability. And if you go on Medicare Advantage, switch and want to go to an original Medicare, it could be problematic depending on if you have health issues. They can either jack the premiums way up or they could decline you altogether and you're stuck with Medicare Advantage. So rule of thumb, and we talked to a lot of different people, is if you can afford original Medicare in general, you're going to have a lot more options open to you. You don't have to go through the periods where you may have to get approvals. And if you were in dire straits and had a really, an aggressive type of some disease or something of that sort, that could really delay the process if you needed care quickly with Medicare Advantage versus original Medicare. We're not going to have to wait for that. And so we encourage most people to look for option 1, original Medicare versus Medicare Advantage. You can make those changes during open enrollment period, which is coming up, which is why we're discussing that right now. And so Stuart also asked, can you change Part D during open enrollment? How about G? Yes. And that's going out and shopping your plan. One thing we find, Rich, how many people don't ever shop?
No, they don't. But let's bring this up for a minute. We're jumping really ahead, but think about, first of all, at RIA, Medicare Advantage plans are fine. They're all inclusive, as Danny said. Sometimes they give you gym memberships. But even though they say they're open architecture, they're a sort of a closed loop. So people get sort of seduced by no premiums, lower deductibles, no deductibles, all this stuff they're giving you for free. It's never free. Okay. Part G are issued by private insurance companies. And that beautifully covers the holes of additional services and some part of deductibles, not all, not for Part B, which is only like 100 and what, Danny, 75, 85 bucks. I mean, it's
Part B is 185. If you're getting a Medigap policy, we're looking usually 125, 150 bucks here in Texas. It's fairly similar across across the country, but there's only a couple of states that don't actually fall under the traditional Medicare kind of alphabet soup, so to speak. And what is that? It's Maine, Wisconsin, and I believe one other, maybe Vermont. But
Sounds
anyway,
like Vermont would do.
yeah, either way.
So you keep this in mind. Why would you want to change Part G? Like, in other words, Part G is private insurance. Unless someone's really giving you a hard time, it's open architecture. You don't have to worry about with Part G. Part D is totally different, right? Drugs can change, prices can change. You definitely want to shop that. Now, say, for example, you just hate your Part G. You don't like United Health Group and you would like Aetna. So guess what you're going to do at that point? You're going to go, okay, well, I better not leave that coverage until I get my new coverage, because Danny brought up evidence of insurability. You will have to provide insurance. There are pre-existing condition clauses that are in Medicare private plans that are not available throughout the rest of the healthcare planet, right? As we know through the ACA. So you got to be real careful if you're changing a G, and realize you can go to any doctor you want. It's just maybe you don't get along with the doctor, or they're not processing your claims. But these are big companies that are providing this service. So D, yes. G, I don't see people do that very often, but you can do it at any time, but risk the evidence of insurability in pre-existing condition clause.
Yep. So here's your different enrollment periods right here. So this is where a lot of people do get a little bit confused. So you have your first enrollment period, which is considered your initial enrollment period. If you're not covered by a group plan at 65, you need to jump on Medicare. That's when we revert back. And if they don't, for every 12-month period, you do not sign up, there's a 10% penalty. Your special enrollment period, and this is a tricky one as well, because this is if you continue to work or you're covered on a spousal plan past 65, and you don't get on when that other plan, or let's say you're retired, you're not working any longer, or your spouse is, you don't get on the other plan within the timely manner. That is an 8-month period. So initial enrollment period is 7 months, and we'll get into those more specifically. And then 8 months for special enrollment. Keep in mind, COBRA does not count for this. And then your general enrollment period is if you missed your initial or special, that's what's coming up through October through mid-December. And so very important that you know these dates and that you sign up within them. So let's talk about when your coverage starts, Rich. You're muted.
Keep in mind with all these enrollment periods, it depends on your situation, and that's what you have to be careful of. Danny's referring to the annual enrollment period, open enrollment, and from October through 15th through December 7th. And that is a really good time to shop your Part D and your Part C to make changes for the new year. I will tell you, if you miss an enrollment period, you miss coverage, because you have to then wait until, say you just missed it. You're 65, you're retired, you miss it. Darn it, I missed the enrollment period. Now what do I do? You have to wait until the next general enrollment period. That's January 1st through March 31st. So you could have a coverage gap, and you got to be real careful. But coverage starts generally before the month you turn 65, the month you turn 65. If you do it the month you turn 65, it's the next month. We usually want it 2 to 3 months before or after as far as enrollment, but this is how you match your coverage, right? The next month, you see, the next month. Most people want to try to leave their employer and make sure that they start their coverage so there's no gap. And if there is a gap, it's very small. So that's why it's so important for you to understand these enrollment periods and when your actual coverage starts, so that you can coordinate it with you leaving your employer's insurance, or if you're looking for insurance, Medicare insurance overall.
All right. So who signs up for Part A during the initial enrollment period? We've kind of already discussed this. Almost everyone who turns 65, unless you're on that creditable plan. So that's where you check with your benefits to ensure that you're covered by a large group health plan. And it can be a pooled plan sometimes. You see this in specific industries where smaller businesses may pool together, and that can be considered creditable. But I would always make sure, because we don't want to chance this, because that penalty that we've talked about is permanent. It does not go away. It will be with you for the rest of your life. And so we talk a lot about, if you listen to the radio show or podcast or read anything, we talk a lot about how do we mitigate risk in markets? How do we, get long-term growth? And then from the planning side, we talk a lot about how do we keep more money in your pocket? And this is a big caveat of that. And so you don't always have to sign up for Part A if you're covered by if you're on that group plan. And sometimes they may encourage you to do so. Now, there's one caveat here. If you have a health savings account and you're covered by a high deductible health plan, you do not want to do that if you're still contributing. So you actually must stop your contributions 6 months prior to signing up for Medicare if you're contributing to that HSA. So do keep that in mind. I know sometimes it catches us by surprise. We get let go. You take a severance package, but keep in mind, if you can control it, we don't want those contributions to be disqualified.
Yes.
That's a big part of it too. I think it's overlooked often. Nobody talks about that enough.
It is. And Stan just brought this up. HSA contributions. So think about this. If you're going to sign up for say you love your HSA, you listen to Danny and I, and we always tell you it's a retirement savings account and you should not tap it and max it out. And if you want to do that and you say, I'm just going to sign up for Part A and I'm still working for an employer that has 20 or more, have creditable coverage, well, then they're going to look back 6 months and be retroactive for any contributions you made, and you're no longer going to be able to contribute. So you got to weigh it out. For me, it's a no-brainer. I would say that if my employer doesn't demand that I sign up for Part A, and most won't, and I have an HSA, then I'm not going to sign up for Part A because I want to continue to contribute to my HSA. My spouse might have an HSA, then they can do family coverage and sort of maybe cover you that way. It's a little loophole in the system. But if you want to make sure you're going to continue to contribute to HSA, you don't want to sign up for Part A. And that's why it's important, to Danny's point, to check with your employer, see what they say. They'll go, no, creditable coverage, you're good, you're fine. So just keep that in mind. So it's a big thing, and a lot of people don't realize that. And as we've said, Danny, I would dare to say in the next 5 to 10 years, every medical plan for every company will be an HSA.
Yeah, I mean, they're
shouldering more of the burden of the health.
That's right. Just like we saw pensions go away and we saw 401ks where the onus is put on the employee versus the employer. I think you're right, Rich. I think we're very likely to see that happen as well. So, Rich, who signs up for Part B during the initial enrollment?
So remember what Part B is. Part B is your physician services, and it does what I like to say. It sort of revolves around A and your hospital coverage, but it also can blood work and so forth. So now, if you're not covered by an employer-sponsored group health plan that covers 20 or more employees when they turn 65, so if you're not working, you're self-employed, obviously you have a company with less than 20 employees, you're on COBRA, you're receiving other types of health benefits. Now, you might have, believe it or not, what's happening also, what I've seen, and I've talked to about 3 people this has happened to, I usually would say to someone, oh no, stay on your current plan because you have creditable coverage and let's not worry. But then I started to say, you know what? She goes, well, it's pretty expensive. These I'm spending $300 a month. It's great coverage. We wound up looking in certain cases, Danny, and it was actually better for this client to actually go on to Medicare than stick with her employer plan. That's what's happening now. And so you got to look at those costs. But Part B, remember, if you miss it, and Danny mentioned this, if 12 months goes by and you just forgot, you just had all kinds of things on your mind, in Part B, you forget, you are going to get a 10% penalty on your premiums for the rest of your life. That's a lot. So then Part D, right? We sign up for Part A, B. This is your prescription drug coverage. And
here's the crazy thing too, though, is that you may not be taking any prescriptions. And so you decline to sign up for Part D. Guess what happens? Later on, you may actually decide, oh, I need this, right? Prescriptions aren't cheap, but you're going to receive a penalty. So even if you don't need it, it's kind of a screwy way that they have this set up. But yes, you need to sign up for Part D because later down the road, it may come back to bite you. And that now, granted, Part D is going to be much cheaper than a lot of the other coverage, generally speaking, 30, $40. But especially if you're on one of the specialty prescriptions, you could really see the need for this. And we don't want to get you that permanent penalty.
Yeah. Also, like for Part D, like Danny said, it sounds counterintuitive, but God bless you if you're not on any drugs. I had a client yesterday. I said, just because we don't want the penalty, you don't take anything, but we don't want to suffer this penalty for the rest of our lives. We'll just go with the cheapest plan possible. And then we may have to shop it if he's on a prescription, if it doesn't cover next year. But at least Danny, what we did was we avoided the risk of the 10% penalty on the premiums, because that enrollment period is 63 days, not a year. It's 63 days. Don't ask me how they got it. I have no idea. When people say, why 63 days? Why is it? I have no idea. I can't find anywhere where there's any rationale for it. So it is what it is. We just want to make sure you avoid the penalties. So these, again, now we're talking about special enrollment periods, right? Because now, Danny, this is what I think you and I deal with most. We're looking at people that are maybe retiring at 68, 69, 70, whatever, and they're now leaving their current employer and they don't have any kind of health insurance benefit. Now they're going to go through this special enrollment period. And this is an 8-month period that starts the month your group coverage ends. But we got to make sure people don't get complacent with this. If you know in the next 3 to 4 months that you're leaving your job, that's when you need to start doing your homework so that you can be ready to turn this on. And then when your group coverage ends, your Medicare starts.
Yeah. And I think that's really important.
That's very important.
There's a lot of employers I've seen now where it used to be, and it still is the case with some people, where you would retire. Let's say you retired mid-month or you retired on the first of the month. And it used to be that usually your insurance would take you all the way through that end of that month. I'm seeing a lot of times, Rich, where that insurance is gone. And so you need to do your homework well in advance. You need to understand exactly what your employer coverage will continue to pay or not. And you need to have enough time so you're not making a rash decision. So if you have that special enrollment period, go ahead and get that started a couple months prior. If you're on the general enrollment period, you've got a 3-month window before your 65th birthday. Go ahead and knock that out. So the best time to enroll in Medicare is, we want to avoid late penalties. So you need to sign up during your initial or your special enrollment period. And essentially, we don't want to worry about gaps in coverage, because if we get outside of that, you're going to have to wait until open enrollment period before you can go back to it. And then you may have to go through that guaranteed insurability, or you forfeit that. And so now you have to provide that evidence of insurability aspect to it, which could make your premiums all that much higher. So do not sleep on this stuff.
Yeah. So Danny, I had a client not too long ago who I could not convince to take G. Like I couldn't do it. Like Medicare Advantage, she wanted all the thrills. And this was, 3 years ago. She finally realized she doesn't have any major health issues, but now she's getting older. And she's like, I think you're right. I'm going to try Part G. But what if she would have gotten a major illness from the time she had Advantage to get to G? If she's had that, G is going to say, sorry, you're not insurable for us. And she's stuck. So you want to do this right up front.
Yeah.
Right up front. Listen, we deal with everybody. There are people who need Medicare Advantage because they don't have cash flow. They don't go to the doctor often. There are reasons for it. But for the most part, we want to make sure you understand this. If you miss, and I mentioned this early on with this general enrollment period, if you miss your initial enrollment period, you miss your special one, you only have a sign-up period or general enrollment between January 1st and March 31st. And then your coverage would begin the month after you enroll. If you miss this January to March, guess when you get to enroll, Danny, again?
Next year.
Next January, which means you have now 12 months coverage, no coverage. 12 months of no medical coverage unless you go on the healthcare marketplace.
And you don't want to do that.
And you don't want to do that.
All right.
So
So we talked about the enrollment periods, three main periods: initial enrollment period, special enrollment period, general enrollment period. Don't get into the general. That's if you're missing any of these. Do it right. Remember, you have a 7-month window, 3 months prior to your 65th birthday, the month up, 3 months after for the initial. Special enrollment period is going to be 8 months from when your coverage ends. And so if you're waiting for this, you're likely, if you're in that general enrollment period, you're likely going to have a gap and you don't want to deal with that. So where do you sign up for Medicare Parts A and B? We discussed a bit ago. You can obviously call them. You can go to ssa.gov. I would encourage all of you, if you've not already done that for Social Security, check your benefits. Go do that. It's gotten a little bit more difficult to log in these days. They're putting a lot more security measures involved with getting on ssa.gov, but it is well worth it to make sure, number one, identity theft. Number two, they have your benefits correct, and make sure that you're calculating not only what your Social Security is, but then we need to think about what does Medicare look like in the future, and should you or should you not be signing up. Medicare Part D, though, this is a little bit different. Rich, talk a little bit about how you'd sign up for that.
So, and this is going to go into Don's. This is sort of going to lead into Don's question, which is a good one. What the heck is Part G? You guys keep talking about Part G. What does it stand for? Gorilla? What is it? So we're going to talk about that. So you got to know A and B. That's your basic, right? That's like, your eggs and bacon. That's the standard, right? D is your standalone prescription drug coverage. Now, Part C, pretty much, you do have to enroll in A or B, but Medicare Advantage pretty much is a one-stop shop. The drug coverage is there, the gym membership is there, vision and dental could be there because obviously Medicare doesn't believe older people have teeth. So you would have to do that, and that becomes very appealing until you realize what you're giving up. So Part D as well is called, so I know it's like we mingle all this stuff in the government, but Part D and Medigap, which is private insurance, which includes Part G, are private insurance. It's completely private. If you go to Medicare.gov, or you can go to our website, click on the Medicare link and do your search for prescription drugs. You want to have all your prescription drugs available and dosages and all that to match the formulary and also your preference for, I always go to the Walgreens on the corner, those kinds of things. And you'll get your D coverage and you'll see the prices. I'm going to tell you, Danny, because of changes to Part D, prices are all over the board. Deductibles and copays are all over the board because of the fact that there's a cap on how much you're going to pay for drugs. And the cap is a lot lower, and companies are trying to make money, and they're creating all these different formulas. It's become a lot more complicated because companies are trying to make money, and at the same time, Biden with the administration had removed the big donut hole and the additional cost. I think it's caps out at like $2,000. Like you can't pay more out of pocket than $2,000. Then all the drugs are, you might have just a copay, but you're pretty much home free. So A and B, that's original Medicare. You shop for your Part D through a private insurer. And also, again, to Danny's point, you're going to get a lot of ads. You're going to get a lot of, they used to be on TV. They're not anymore. Like Jimmy J.J. Walker, and it was nice to see William Shatner and Joe Namath. I haven't seen in years. He's out there touting Medicare Advantage. We don't see those as much anymore. The government sort of cracked down on them because it's very difficult, because we think of some of these private insurance companies as government, and they're not. They are private, and they work in connection with the government to provide the benefit, right? So you got to know the difference.
So here is the out-of-pocket costs paid by Medicare beneficiaries. So we've discussed, Part A, you've already paid into. Part B, premiums are paid to Medicare. Part D, plus a Medigap policy is going to be paid to that private insurance company. Medicare Advantage is going to be similar. And then you got to think about other out-of-pocket costs. So similar to what you guys have now, deductibles, portion of doctor bills, not paid by Medicare, services not covered by Medicare. But a lot of these are those holes we discussed that are going to be filled with that Medigap policy, basically that additional coverage is supplemental that you're going to purchase on the open market. So this talks about monthly premiums here. So Part A, paid to Medicare, $0 if you or your spouse are covered into Social Security. So 40 quarters, 10 years, right? One of you's had to work for Social Security for at least 10 years, or work and paid into Social Security for at least 10 years. And then you can see if you're under those amounts, what that cost would be. There's a lot of times we visit with people that may have worked in a different area, a government job or something that did not pay into Social Security. And that's another good reason to pull up SSA.gov. You get a very good understanding, and it could be advantageous for one of you to go out and actually finish. And it may be working. You don't have to make a whole lot to actually qualify to get that quarter. So we've had people who have 38 quarters, 39 quarters, and they may go find a job that's more of a hobby, something they enjoy to reach that additional quarter. Your Part B, that's going to be paid to Medicare. This is $185 a month. It does have IRMA charges associated with it. So that's income-related adjustments. And so essentially what that means, this is the way that they means test. Everybody's like, oh my gosh, what if they ever means test? They're already doing it. And if so, they have income limits. So if you make, for instance, over $106,000 if you are single, or if you're married filing jointly, you make over $212,000, then you begin to see that your premiums for Medicare for both you and your spouse actually go up. And then it can go up, considerably the more money you make. There are ways to potentially get around that depending on if you lost a job, death, divorce. They call them life-changing events. It's a form we have our clients fill out often called SSA 44, something that you should write down, because a lot of people do have to go in and say, okay, let's try to appeal this. And then Part D, that's going to be paid to your private insurer. So that's going to vary as far as what the cost is. But generally speaking, I mean, Rich, you still seeing $30-40 a month? Yeah. And that's one you really have to be cautious with. So if you're going to sign up for Medicare, and so Rich, I mean, you do this quite a bit. We would say, okay, we need to fill out we want a list of all your doctors. We want a list of any prescriptions that you're on. And then you should be right-sized to the exact policy that you're choosing. And
yes, if you go to our site at Real Investment Advice, you'll see a Medicare Insure link, and there's something as connect with an advisor, and you can input, to Danny's point, all your drugs and your doctor and so forth if you need help with the coverage. And that's to answer Johnny's question. Hank's talking about income-related adjustments. So this income-related adjustment stuff is very sneaky, right? Mm-hmm. We've always been told that when you retire, you're going to fall into the lowest tax bracket. And there was a point in the 90s where that was true. But now the government finds different ways to tax you. And we call these the back door, the back pocket taxes, because you don't know they're taking your wallet, taking the money, putting it back. Part of it is taxation on Social Security. The other part are these income-related adjustments. And keep in mind, that's based on modified adjusted gross income, not net of your Social Security payments. So in other words, yes, if you're making an investment income, if you're pulling money out of your IRA to live, right? And it's in your modified adjusted gross income, that's almost gross income, right? The gross income is your top line. You don't have much to go before you hit adjusted or modified adjusted gross, right? So it's going to net out any taxes you're paying on Social Security. But what I'm saying is, yeah, what you think might not count most likely counts in the income related adjustment. Roth distributions don't count. Policy loans against permanent life insurance don't count. But anything that generates income for you is going to count. And that would include investment income and dividends and interest and other things if you hit those thresholds. It's a good question, Hank. Thanks.
Yeah, it's a really good question. And, it goes to Social Security as well. I know you just did one on that here a month or so ago, Rich, where, if you make over $35,000, between 35 and 44, well, then up to 50% of your Social Security can be taxable. If you make over 44, then you can have up to 85% of it taxable. And so, there's a lot of different things. And that's why we encourage people to start planning early, because we want to help mitigate some of those issues that you may see. And to be quite frank, there's a lot of people who've been retired for a long time. We get people to call them like, oh my gosh, my Medicare premium just went up to this. And I'm like, all right, well, what happened this last year? What did you guys do? Right. And there's a 2-year look back period for that IRMA. And like, oh, well, you look at tax returns. Oh, you guys sold a whole lot of stock, or you sold XYZ, your capital gains are way up. And so there are a lot of different events that can trigger this. And that's why it's important. For years, we were taught to put everything in pre-tax. And now, if you're still working, we can make a pretty compelling argument to begin putting funds in other areas and paying the tax now. Because as you said, Rich, most people aren't really retiring in a much lower tax bracket than where they are now. It doesn't happen like everybody claimed it would. Hank, you're asking, what is the maximum adjustment to the premium? This is the actual chart here. So you can see it goes all the way up to $714. Now that is if your income has to be pretty high, right? It's going to be way up there, over 750,000. But this can really impact a lot of people. And so many times it may be deferred comp. It may be they've sold an investment property. They've sold stock, taking distributions out of IRA accounts. I have seen people make extremely large Roth conversions and say, you know what? I've done a really good job saving. I know I'm always going to be near the top tax bracket, but then I'm going to have to pay IRMA every year when I hit my RMD age. So I'm just going to bite the bullet and go ahead and really convert a large amount over the next 2 or 3 years and say, all right, that'll get me way down. And so long term, it can be beneficial.
Hey, you want to check if everybody's still awake after lunch?
Yeah.
Or during lunch. What do you all see is the difference between this table and your federal income tax marginal tables? Do you see the difference with this table? Right? We have a progressive, we have a tax system, right? The more you make, you fall within brackets. The next dollar you earn goes up to the next bracket. Do you notice this is a cliff kind of situation? Like if I only make $212,000 and $1, I can have $1. $1.
It's not the marginal tax brackets like we would typically have, where your effective tax rate is lower.
It's a cliff, right? So when you start to retire, you start to realize, am I falling off the cliff? Where am I? Because it's not now taking it from 212,000 to 350,000 or whatever. It's $1 more, and you're paying more. Now, this only lasts a year. If your income is adjusting, say you had 1 year, and we're probably going to talk a little bit about that. So remember, Medicare looks back 2 years at your income in 2 years. So think about this: you retire at 67. What is Social Security and Medicare going to look at? Your income from age 65, and you were making a heck of a lot of money, and you're like, well, that's not fair. I'm retired now. Well, you can fill out a form, SSA-44. This is a life event, one time, that you can fill out, because you're saying, hey, I'm not going to be making this anymore. I'm moving into a lower bracket. I'm retiring, and they'll adjust it. So be careful of what you are looking at for income and how your modified adjusted gross income is going to be affected.
All right, guys, we talked a little bit about some of the deductibles you will pay. So Part A is $1,676. Now, that's not per year. That's per spell of illness, which basically is going to mean hospitalization, because Part A, remember, that's going to cover that aspect of it. Part B, $257 per year. A lot of preventative services are waived where they're not, they're encouraging you to do more preventative care. So a lot of times they're not charging you for that. And then Part D is $590 per year. So pretty basic there. Here's the coinsurance. So this is going to also be the amount you pay. So Part A is going to be $419 for days 61 through 90. So remember, the hospital care is going to be covered from day 1 to 60. And then it's going to go up quite a bit $838 for days 91 through 150. And then skilled nursing's $209.50 from days 21 to 100. So let's say you need to go to skilled nursing to go to rehab. Now it's a little bit different, right? Now, your Part B, the assigned claims, 20% of Medicare approved rate. And then your unassigned claims. And this is where it can be problematic, and you have to stay on top of this from a billing perspective to know if number one, they're coding things properly. So I've heard often and seen that a lot of patients will have to go back to the doctor, and they're fighting this. And it's a shame that you have to do this, but it does happen from time to time if things are coded wrong. So the unassigned claims are 20% of approved rate plus the balance of an actual charge up to an additional 15% of what they approve. So that could be pretty significant depending on what type of care you need. So this just pays to do your homework to make sure that you're dealing with somebody that deals with them on a regular basis. Most doctors that do take Medicare, they have to have a pretty big staff just to put these in the system.
Yeah, so Rick said, does Medigap policy pay the coinsurance on Part A? Yes, on Part A, but not Part B anymore, unless you have an F plan. F is in Frank. When you go to so keep in mind, Medigap policies are standard. You have letters, and you need to go to the Medigap site and look at that table and go, this one is for me. Like, I want to go into the hospital, and I don't want to pay for anything. I've had clients that have Part G. They walk in, they have one client had open heart surgery because I still have gotten out a bill. Because Part G covers those holes really well. And in some cases, when you're traveling. So I'm going to go, that would be my policy. And then Johnny asked about, hey, I might as well go on the private market and forget this with Medicare. It's expensive. Well, guess what? I don't even know how Medicare stays in existence with the price on these premiums. It's because they're subsidized by the government. You will not find coverage this inexpensive and this cost effective if you just decide that you don't want to go on Medicare. Unless someone's paying your policy, then that's different. But I'm saying, if you are looking at this, you got to realize this is the best deal in town. That's why it's hurting right now, right? That's why we're worried about it. It's the best deal in town compared to you going out on the marketplace, believe me. So, and we count for these costs in our plan and also the rate of inflation on these particular plans.
All right, so talk about the Part D coinsurance, Rich.
Well, this is the bet usually pay. There's like a deductible, and then you'll have 25% of the drug costs after deductible have been paid, and then you have no further costs after $2,000. But I am telling you that because of this $2,000 out-of-pocket cap, we're starting to see insurance companies trying to figure it out. And part of that is the insured handling more of the burden. So my thought is this is going to change. This is going to change. But that's what it is now.
Well, and that's why this is also so political, right? Because you see so many different politicians talking about this. Because unfortunately, here in the States, we pay for the majority of R&D, the research and development of drugs, and most other places get it for much cheaper than we do. So they need to level the playing field, and that's why you can, it doesn't matter the administration or which political side of the political aisle you sit on. This is a very hot topic, and it does need to be addressed. This is a bipartisan
plans. See where it says in Part D in there, your individual plans vary. Oh boy, do they! Since that 2000, they are a pain in the neck. Because it's all nuanced. Well, if I pay more for this, but what if I'm on more expensive drugs? I got to weigh like all these things like Columbo to figure it out if I'm on drugs, like I'm on my prescription drugs. It's not as easy. That's the one I find the worst. It really drives me crazy. So this is what Medicare covers, right? We got hospitalization, 100% of your first 60 days, your medical services, preventative services. This looks like the beginning. We were just wrapping this up. This looks like the beginning.
I mean, yeah, it's pretty basic here.
Yeah.
So, and then here's what it doesn't cover. We talked a little bit about this already: dental, vision, hearing, cosmetic surgery, care delivered outside of the US. So you do have to, there's a lot of times when people travel, especially to specific regions, you may go buy for the time you're there, a different policy that'll cover those international travels. Long-term care is one that a lot of people think Medicare covers, but unfortunately it does not. And so really just kind of basic stuff here. We always joke you're going to have a lot of people kind of fumbling around, elders that can't see, can't hear, and can't eat or talk. It's pretty bad. You would think they would cover this. You think that's a necessity.
There's some weird thing with the dentist union. I don't know what it is with dentists, especially. So keep in mind, Medicare will pay for a nursing home stay after an illness for a period, but it's not long-term care. It's because something happened to you and you need long-term care for a period in a nursing home. That means you're going to leave. Long-term care is when you can't do certain activities of daily living, like bathing and eating. Okay. So Medicare is not long-term care. It provides some type of long-term care service connected to something else, but it is not going to provide what you think. And that's what a lot of people mix up. Like you said, Danny, I don't know. But I will tell you, there are a lot of companies out there that provide dental and vision insurance privately that happen to be cost effective. And if you do it for anything like, hey, I take my vitamins, I take my acupuncture, no, that's not going to happen. So those are things that you're going to not have to.
Well, and it's also shocking how cheap it can be if you say, hey, I don't have insurance. They'll say, oh, great, we'll do it for $100. But if you have insurance, they're still collecting that $100 and then some. So sometimes it pays not to have it in some instances. Now that would typically be for just, like if you're going to get your teeth cleaned, something of that nature. But I wouldn't say don't forego it for that reason alone. But it's kind of crazy how much cheaper it can be if you just pay out of pocket.
So Don asks,
go ahead.
Yeah. So Don asks, is Part B versus Part C versus Part G, which is cost effective? Well, it depends on how you look at costs. It's a great question, by the way. If I look at costs in the form of, oh my gosh, my daily cash flow, and I go, oh my gosh, I got a Medicare Part C with United Health, and there's no premium at all. Oh my gosh, this is like the greatest. That $100 I was going to give, now I can use, right? I'm cash strapped. But then I get a serious illness. And this covered, the doctor goes, well, you have the special coverage. And guess what? We only do this for this. In other words, we do this treatment for this. Well, I read about, and I went to another doctor and they said, you can appeal. You can appeal, but the odds aren't good. And meanwhile, you're still ill, right? So that to me is a greater cost than the premium I'm going to pay in Part G, which I am going to pay a premium, but I'm going to get everything pretty much covered. So it depends on how much risk you want to mitigate. Like there's a whole thing, and I'll talk about this just for a minute. There are people now that self-insure their homes because homeowners insurance, as we know, has gone through the roof.
Oh, man.
So, but think about this, Danny. Think about how many wealthy clients that you have, and that go, you know what? It's $400,000 if the house burns down. I own it. I'll just rebuild it. If you want to self-insure some of your stuff on medical side, then Medicare Advantage maybe work for you. But if you want to make sure you're covered for everything and you can go to any doctor you want, then you want Part G or some form of that letter grade that you're going to see on Medicare.gov. But it's called Medigap. That's the umbrella that covers all those letters. I feel like I'm in Sesame Street. You want to do the count, Danny? So Part G, or say you use Part L or M, whatever, because it's doing what you want. Part G is the Cadillac. Part G will cover everything. If I want to walk in and walk out and not worry about anything, I want my Part G. And it's going to be more cost effective because somebody said, mess all this stuff. And I talked about this already, but I'm not going to do this anymore. I'll just go on the marketplace and get insurance. Too expensive. Now you could have a healthcare insurance plan through your work, Like you have a retirement healthcare plan. We don't have many people who have that. But you got to do an apples to apples comparison. This is my premium, and this is what I get from my healthcare plan, retirement healthcare plan. This is what Medicare Part G and all the other letters equal. Am I getting the same or better? Which one? Generally speaking, usually the one with the company is better. But what have you noticed, Danny? That a lot of these companies are now going to Medicare Advantage plans, aren't they?
A lot of them
Not
are.
Medicare.
Most of them are.
Mm-hmm.
In fact, very few I see out there that actually have a traditional plan. That employee retirement plan is essentially going to be it. And now it's gotten better in the sense that where we used to see only those HMOs, now we're beginning to see the PPOs for Medicare Advantage. But most of those are Advantage plans. And many times you got to really do some homework to figure that out. And a lot of them are okay. I know plenty of people who are on Medicare Advantage. Like, it's great. Never had a problem.
It seems like it's more with the company. It
Yeah.
seems like it's more like a Medicare Advantage with muscles to it. Like it's not like your standard one. Like they're adding some other things into it that actually make it almost like a Medicare Advantage Plus versus just going and listen to Joe, Namath, because, he's Joe, and buying a policy, right? Calling eHealth Insurance or going through us or anything. So I think but you have to make those comparisons. You have to make those comparisons.
All right, guys, in review here, we've got a handful more slides we want to get to continue to answer your questions. So what private insurance may cover in full or in part. So a lot of times it's going to pay the deductibles or coinsurance amounts, such as that Part A. So I think, Meg, you asked something about the hospitalization per day or per visit. That's per day. So it can get really costly. So you see that hospital cost after 60 days. The 20% of doctor bills that Medicare does not pay. So, yeah, I know you guys are looking at it and saying, oh, man, this can be expensive. But for many people, it's not all that different from what they're paying with their employer many times. And you're getting really good care. So, and then the amount the doctor charges over the Medicare approved amount. Maybe Meg or somebody else asked about assigned and unassigned payments. And essentially going to be if the provider approves, that means they approve what Medicare is going to pay. They say, great, Medicare takes care of everything. But if there's anything in addition that they don't approve, that would be that unassigned claim that you'd be responsible for. Prescription drugs, deductible can be sometimes in full or partially covered. Most of the cost of certain drugs during the initial benefit period and catastrophic coverage. When you really need to be careful, there's Rich, 26 specialty drugs that can be extremely expensive. And so I know we were talking earlier about how you can shop during open enrollment. That would be a time to shop prescription drugs because we want to make sure they didn't just kick yours off the platform and you got to go find another carrier. Yeah. So these Medigap policies, private health insurance for individuals sold by private health insurance companies. It is that Medigap supplemental for original Medicare covers Part A and B and follow federal state laws that protect you. So remember, it's going to be very uniform for the majority of states outside of those three that we mentioned. It was not Vermont. It was Minnesota, Rich. Pretty sure. Oh.
Yeah, but someone asked, can you have Medicare Advantage and Medigap? No, it's one or the other.
Yeah.
Like you can't buy both. Like you want one or the other. I want the whistle. I want the gym membership, silver sneakers, and all this other stuff. And I don't want to pay a premium. And I'm willing to go to I'm willing to go to this hospital, this doctor, this, it's out of my control. So you would need to leave Medicare Advantage. But before you do that, you better make sure if you want to sign up for Medigap, you can go through the pre-existing conditions. So you don't want to take away from your Medicare coverage. You can go back to, and during enrollment periods, like you can go back to original Medicare out of Medicare Advantage. But you just got to be real careful that you already got your G in place and you're not going to have a big gap, if any, in coverage before you do it.
I mean, think about it like any other insurance. You're not going to let your car or your home insurance expire and then you don't go get a new coverage so that it adds up, right? You're not missing any days. We don't want that gap, just like anything else. So here we go. 3 states that are not the same. Massachusetts, that's Maine, Minnesota, and Wisconsin. So these do not work with Medicare. You do pay a monthly premium, and those costs can vary by plan. In general, they're probably pretty similar. Most people do go with the larger big name coverage, Aetna, United Health, Blue Cross Blue Shield, but there's plenty of them out there. We generally kind of look for the bigger names, even if it may cost a tad bit more, because most of the time you're going to get a lot broader coverage as far as what doctors actually accept. Medicare Advantage plans, Rich, I'll let you cover this since I know this is your favorite.
I thought that was your favorite.
Oh yeah, well, hey, cheap.
Well, listen, it's just something that there's nothing wrong with them per se. There are some people that are very happy on them, and they don't go to the doctor that much anyway, and they're like, they're willing to roll the dice. And I had a client that had pancreatic cancer, and had to pay $50,000 out of pocket and go to the doctor as they suggested. You may not want that, right? You may want to just walk in, walk out. And that's important. So you have to use the network. You'll have prescription drugs. It is in some ways, you got to remember, Danny, right? It's convenient, right? I mean, when you think about, forget the money for a second, what qualitatively would you look at for Medicare Advantage? Well, I get this all in one. I get everything's covered. And I'm getting my dental and all that, but you got to look at the quality of the care. And for me, it's always the outlier issue. Like there's a cancer or heart disease, and I find a treatment that I want and I can't get it. Or I don't want out of pocket. I'm willing to pay the premium because I don't want a $50,000 out of pocket bill. It's not, I'd rather mitigate the risk. So it goes back to how much risk do you want to mitigate? Overall. But yes, they are popular. A lot of people use them. They add new benefits every day. I'm happy to change my mind, and I'm happy to help you if you need one. But the point I'm making to you is if you can't afford it, you're better off looking at MediGap. Yeah, and Stuart said it. Part C won't cover medical trials. It won't cover a lot of things that you might want. Now, if you're just standard, doing your own thing, you're fairly healthy, I understand why you would look at that. As you get older, you may find that that's not exactly what you want.
All right. So it's important to shop these carefully. You need to understand what different type of coverage you may need. If you don't travel often, if you're kind of in a specific area, you may not need a G. G is going to be the Cadillac plan of everything that you have there, right? The drug coverage, we need to make sure that they cover everything. And then understand what those Medicare Advantage plans are. Great example, Kelsey-Seybold. You reach 65, you want to stay on, utilizing those doctors, you're going to need to get a Kelsey-Seybold Medicare Advantage plan. So you've got to be cautious and understand that there may be times that you need to make a change. And, things you just talked about, Rich, are things that would worry me the most. If you needed to go to the Mayo Clinic, or you needed to go to Cleveland Clinic, or MD Anderson, and what if that is not covered, or what if you're waiting on somebody to approve it? You may not have that time. Time may not be a luxury.
That's time is your time is right. Your real enemy, right? You want to get this done as soon as possible. And to your point, what if I do want to go to Mayo Clinic, or I do want to go to, there's this doctor and this amazing treatment at MD Anderson. Sorry.
Yeah, may not be able to.
We do this. I got that from a breast cancer patient of mine, client. We do this. You want this, but we do this. And now she can't move. She can't go from Medicare Advantage anymore to G or Medigap in general because she's got a pre-existing condition.
Final word on healthcare costs. These numbers, I think most of you will understand and know this, but these numbers are really high. And healthcare, in fact, when we're doing a financial plan, we will inflate healthcare costs at a much higher pace than we do regular inflation. And kind of similar to education. Education and healthcare are two of the fastest growing or most expensive on a year-to-year basis over our regular expenses. So keep in mind, the healthcare costs are going to be higher premiums. We do see that. It seems like recently, Rich, they've gotten a little bit better where we haven't seen that. Where it used to be, it was like exponentially higher. It seems like
it's going to be six. It's going to be 6. It'll be 6%.
Yeah,
still high though.
5.6.
Yeah.
Yeah.
I mean, compared to some things, I mean, if you're looking at the Fed, the way they look at inflation, but, we have to study that and make sure that we have the right rate of inflation. Here's the thing. I used to have it as 5. And then reading all the Kaiser Foundation studies and Senior Citizens League studies, we adjusted it to 6. And now you're hitting that. I just did it about a year earlier, and now they're starting to. Now we're at the breach. We're right there at 6.
Yeah. So keep in mind, health status changes. If you're on Medicare Advantage, it can be difficult to get back to original Medicare. That is why we do typically say, hey, you can afford original Medicare, that is where you go. And then keep in mind the things that are not covered by traditional Medicare: dental, vision, hearing, and those alternative cares or long-term care, which seems to be always the one that people get taken by surprise. Like, oh my gosh, it doesn't cover long-term care? No. And that is at a very expensive cost. So planning for future healthcare cost, we see all different types of numbers. Fidelity had $315,000 for a couple who's 65 years of age, what they're going to spend and premiums, deductibles, out-of-pocket expenses on healthcare. So if you do have the ability to utilize an HSA, put that money in and sock it away. Remember, it is not a flexible spending account. You do not have to spend it each year. You can let those funds grow, and then you can also, in many cases, invest those funds. So if you're younger, you can, obviously put a lot more money into it over the years. But and that is my favorite account. We do things just on the HSA because I love them. The only account you get a triple tax benefit. I wish everybody had the ability to contribute to them, but you can put the funds in tax-free. They grow tax-free. You take them out for those medical expenses. You're going to get them out tax-free. You can see here, employee benefit research institute says $296,000 for couples. Health Use Services says about $350. So that number continues to go up, and everybody's number is going to be different. This is just an average, so keep that in mind. Some people may be much less. Some people may be much more. We need to think about longevity. If we all knew our expiration date, all of this planning would be that much easier. Unfortunately, we do not. So we got to take that into account. Current health, lifestyle, all of those things go together. Good health equals much better wealth long term. And then planning for long-term care. I mean, Rich, how often do you add a long-term care expense into a plan and it blows it up unless you're selling the home or you're doing something else, right? I mean, that can catch a lot of people by surprise.
Yeah. Bruce got a little confused by what we said, but
Yeah.
we said that you might have been contributing to an HSA all along. It don't touch the money, right? You can't contribute anymore once you're on Part A. But we look at those accounts as accounts to grow, thus can be used even for some portion of long-term care premium, some portion of your Medicare premiums, and other costs. And you want to really exhaust that before you pass on, right? But it's a great benefit to have. So long-term care, again, you're going to have no coverage. So if you need skilled nursing care or help with activities of daily living, because you don't get coverage after 100 days of skilled nursing care, right? The average is 28 days. So long-term care is a totally different insurance. And when you look at all these polls by many reputable companies, you see that most people tangle them up like Christmas lights. They're all, they're not the same. So keep in mind, you might need a separate long-term care coverage. That all comes with financial plan. You do your financial plan, that should tell you. And here are the costs right now, long-term care today. Obviously, more people want to age in place, also means services to the home, right? Home health aid services. You might need people consistently throughout your life. And that's not cheap.
Yeah. And so think about this. That is per day. A lot of times you need to factor in if you are married, is somebody going to stay at home still in good shape, but they can no longer take care of their spouse? Well, those expenses now, your expenses are much, much higher, right? If you're aging in place together, are you going to have a home health aide come to the house? These costs add up, and depending on, how long you need to utilize them, it's very, very costly. The average person uses it for about 2 years. but I've seen, my grandfather utilized it for about 8 or 9. So
that's what I think we're facing in the future.
Yeah.
We're going to have healthier, older people. If you have people who have dementia, one of my really close friends who passed away had been in a facility, controlled facility for 10 years, physically fine. And you got to keep this in mind that these can be very expensive. Now, this is also very geographically sensitive. So when we do a plan, we also look at your state, because I ran one for like Vermont, believe it or not, the other day, and it's like $400 a day or something for a home health aide. Yeah, California, New York, these are, man, these costs you make you a nosebleed. I mean, so some people might even move and say, I can't, they might do long-term care facility in another state. I've seen that happen because of the variation of costs and quality of service across the country.
Yeah, and there's a lot of places you can even just go out there and Google long-term care costs. You can look at Genworth does a pretty good study. I think the other one's Transamerica maybe. But there's a lot of
Genworth is the best. Yeah, Genworth, you can put your zip code in and get a feel, because they're the most accurate, I've noticed.
Yeah, absolutely. So, why plan for long-term care? Obviously, you don't want to be a burden on your family. Avoid having to spend down assets to go on Medicaid. You got to think about this. Medicaid has a 5-year look-back period. And so, it's nobody wants to be there. And I hear a lot of people say, I'll just get on Medicaid. No, please, you don't want that. There's many people that have to. And listen, you got to deal what you got to deal with. But at the end of the day, that is not the right solution if you do have assets. And if you have a legacy intent, that can erode a lot of that as well. So keep that in mind as we're looking at it. So big 3 today, I think that we've covered. We've gone a little bit over time. We appreciate lots of good questions. Yeah. Enroll Medicare on time. Don't go to that third one, though. Make sure you know your initial or your special enrollment period. Shop your private insurance when you get on Medicare. Make sure you're doing your due diligence. Don't get caught by surprise later. I still hear that. I never quite understand that, how, if somebody's helping you, you need to take into consideration all of those factors. If they're not, be very, very cautious, and then plan for those higher healthcare costs in retirement. These are things I think that are extremely important. All of those. And I know this can be confusing. Excuse me. I can't even talk today. Confusing. Yeah, there we go. We do help with this. So if you need help, Richard can help you with this. Craig can help you with this. We're going to factor this into our financial plans. We're going to send out a survey. If you have questions, put them in the survey. If you want somebody to contact you, let us know. We'd love to help you any way that we can. But if you get past that survey and something comes up, get online, realinvestmentadvice.com or riaadvisors.com. We do have an Ask a Button tab there at the top. Do not hesitate to ask. We'd love to help you any way that we can. And thank you guys for spending some time with us today. And let us know if there's any other topics you guys would like us to address, or criticism. Only constructive, though. Thank you. And we're going to be out of here. And you guys should be able to get online here in a day or two. We'll have a recording for you. Have a great day.
And the recording will be sent. Yes, Jim.
Bye, y'all.